A kidney transplant is a surgical procedure to place a healthy kidney from a live or deceased donor into a person whose kidneys no longer function properly. Kidney transplantation is advantageous over dialysis due to several reasons. It is less time-consuming compared to periodic dialysis. Dietary limitations are less, although following a heart-healthy diet is necessary. It improves overall well-being and quality of life of patient. Survival is longer in patients who undergo kidney transplant. However, it may be associated with certain risks like side effects of drugs which are necessary for prevention of transplant rejection. Some surgical complications. Not all patients are suitable for kidney transplantation. Transplant is considered in patients with advanced stages of kidney disease. It is important that transplant recipients should be healthy enough to receive an organ and should not have infections or cancer. In addition, an organ, which is suitable for your body, which will not likely get rejected by your body, should be available to perform transplant. There are mainly two types of transplants based on type of donor. One, deceased donor transplant, where kidney is received from a dead person. Two, living donor transplant, where kidney is received from living person. When there is a donor whose kidney is not compatible to a potential recipient, medical details of both are entered in a registry. The registry finds another compatible donor for this recipient and finds a recipient compatible for this donor. Example, if donor A's kidney is not compatible for recipient A, and donor B's kidney is not compatible for recipient B, the registry pairs donor B with recipient and donor A with recipient B. If the compatible kidney is not available, the registry can identify kidney in a chain-like manner as shown in this image. For ease of understanding, let's divide entire process into 3 parts: 1 before transplant, 2 during transplant, 3 after transplant. Blood test is done to ensure the donor's kidney is an appropriate match for you. Diagnostic tests are done to check your health status and diagnose infection and cancer. A mental health evaluation. Before the procedure, you would be explained about surgery and consent would be taken. If you were on dialysis, dialysis is done before transplant. You would be asked to fast for 8 hours. Kidney transplants are performed with general anesthesia, so you're not aware during the procedure. The surgical team monitors your heart rate, blood pressure and blood oxygen level throughout the procedure. 2 during transplantation. The surgeon makes an incision and places the new kidney in your lower abdomen. The blood vessels of the new kidney are attached to blood vessels in the lower part of your abdomen, just above one of your legs. The new kidney's ureter, the tube that links the kidney to the bladder, is connected to your bladder. Unless your own kidneys are causing complications such as high blood pressure, kidney stones, pain or infection, they are left in place. 3 after transplantation. Doctors will keep a close eye on your health to watch for signs of complications. You may be continued on dialysis until new kidney produces urine. Catheter will be removed once you recover. IV fluids will be given until you can eat orally. Blood samples will be frequently taken to assess your health and health of kidney. You would be slowly given solid food. Once your health is stable, you would be discharged from hospital. Medications would be given to avoid rejection of kidney. Once you go home, you have to follow doctor's instructions regarding daily activities until complete recovery. You have to visit the doctor as suggested by him to review your medications, etc. To allow the transplanted kidney to survive in your body, you will be given medications for the rest of your life to prevent rejection. Drugs called immunosuppressant anti-rejection medications help keep your immune system from attacking and rejecting your new kidney. Additional drugs help reduce the risk of other complications, such as infection, after your transplant. You have to promptly take medication to avoid rejection. Hygiene and vaccination must be followed to prevent infections. It is important to follow a healthy lifestyle to avoid other illnesses which can impact new kidney. After transplant, most people can live a regular life, eat healthy and can do regular work.